My name is Elizabeth Dean, and I graduated from the Center of Food Policy in 2021 actually. And I'm very pleased to be having this conversation. I would like to introduce Martin Caraher. He is Professor Emeritus at the City University Food Policy Center. He is an esteemed author with several bylines. He's written numerous books. And I'm very, very pleased to be chatting to him about the right to food in London and some of the implications for that. Right now, our motion that we've written is really focused on the inequity that's existing in London, the lack of access, the poverty, the inequality, and so we're really hoping to launch the Right to Food London from a rights-based approach and from a human rights and human dignity approach as well. And you had mentioned in your panel about the public health dimension. I was just wondering if you could speak on that a little bit.
Okay, I mean, in terms of London, one of the things, you know, London's difficult because of the boroughs, and the boroughs exercise independence, and the mayor has oversight on a number of things. So he has oversight on planning, which has got, I mean, could have something to do with food security. So he could set standards for food security in terms of planning. That doesn't mean he controls planning within the boroughs. It means he sets an overview for planning. So he could say, you know, he could say local areas should have this shop, that this type of local availability within them. And the second area he's got control of is public health. Now, I mean, I've argued with obesity. People keep saying obesity is a public health problem, and it's, you know, it's an epidemic. This was before the pandemic. He could step in and take control. In a similar way, if we argue that food security is now a London national emergency, he could possibly use the public health agenda to step in and have a right to food across London. Now, you know, I mean, in real terms, the mayor's powers are limited. It's when it comes to an oversight, or when somebody appeals something, he has power. But with public health, he could do it. I don't think there's a political will there to do it. I mean, I don't think the London Food Board have even considered this. The London Food Board, to my mind, should have stepped up to this during the pandemic and suggested some solutions. I mean, why didn't they? I don't get it. I don't know why the mayor didn't ask them to look at what could be done with food in the pandemic across London. Or maybe they had meetings that we don't know about, but I certainly heard nothing about that. So the mayor could intervene on public health across London.
And do you feel that the London Food Board and the National Food Strategy, is there an overlap there, or is there something that local boroughs can do?
In terms of food poverty and food insecurity?
Yeah.
The National Food Strategy, I interviewed Henry Dimbleby a couple of weeks ago at a conference, at a food festival, and he was very pleasant. I mean, there's very little in the food plan to disagree with per se, but one of the things that was excluded, and he says it at the beginning, was food insecurity or food poverty. It was excluded from his brief. Now, why is that? We need to ask. And the other problem with the National Food Strategy is it's not a strategy. It's a series of options which the government can pick and choose from. So they're due to report in March, maybe April, but they have to have a white paper in March, April, responding to the plan. So they could cherry pick, you know, they can, but food security isn't in there. I mean, it isn't even in there for them to cherry pick from. I mean, it was deliberately excluded from his brief. Now he showed, I mean, I'm not a fan of his. I'm not a fan of the process, because it seems to me what the National Food Strategy does is it skirts due process. He's an independent advisor, so he makes independent advice to government. This has not been discussed in Parliament. I mean, this seems to me the first time it will be discussed is when the white paper is introduced in 6 months' time. By that time, the government will have, I don't know, chucked out the sugar and salt tax, etc., etc. But it's the governance issue. Now, he raises in the report, he says, for example, school food has not been implemented in the way it was planned, which is true, and the pandemic has made that worse. Companies are really skimping, we know, on school food in terms of quality and in terms of the nutrient issues. Wrote that plan in 2013, Henry Dimbleby. So again, we've got a situation where government will set up something, but there's no due governance. But I don't think, for you, food security is not even in there. I don't think food security will be part of the National Food Strategy. Now, the London Food Board, I don't know what it's doing. I really don't. I think it, it could be really important. It could help set an agenda. I don't know that I just don't know what it's doing anymore. It seems to be focused on charity and food aid provision. And there's 2 or 3 members of the board who come from that background. So it's, it's weighted that way, and people are afraid to criticize them, Fair Share and food banks on their membership on the board. There's no right to food being talked about there, which seems to me really strange. I don't get it. I was on the original food board, and we had at least a statement of inequality. The new strategy doesn't even have that in it, in my opinion. It skirts the issue. Everybody's skirting the issue of food security or food poverty.
Yeah, it seems as though there's been, a similar rise, like with the charitization and the lack of willingness to talk about food insecurity and food security more broadly. It's almost as if there's a feeling that, companies and businesses will just come in and take care of the problem. And that kind of brings me to another point of just, the dignity aspect of food provision. Can you kind of speak to that a little bit more about how we can create a system that's dignified for people? And is the right to food one of those ways?
The right to food is necessary, but it's not on its own sufficient. My criticism is Sustain have been running a campaign since 2005 on the right to food. And what have we seen from that? Very little. But it's necessary. I think there's a more adversarial approach needed with the right to food. What we know from other countries is it's when the government or regional governments or federal governments have been taken to court, or the legal challenges have arisen, that action has come about. There's a study from, I think it's Belgium, is it Belgium and the Netherlands, saying that people have found it really hard to get it written into constitution. Even when the will exists, it's been difficult. I think it's necessary, but it's not sufficient. I think it is about the dignity issue, and the thing to do is, as look to Scotland. I think it's been slightly delayed because COVID has thrown everything into chaos. But the dignity issue in Scotland and the dignity report and the dignity issue are what they are trying to address. And food banks are not going to go away. I would, my opinion on this is that I'd shut them all down tomorrow. And move to cash transfers for people. That's what I think we should do, but they're not going to go away. But the Scottish government have set a standard of no new food banks, and people will be able to afford a reasonably healthy, affordable diet. That's standard, so it's a reality. No new growth, essentially, of the charitization of food. The Shutter says, if you. Olivier de Schutter, when he was the special rapporteur for food, he's now the special rapporteur for extreme poverty, I think. He's got a new post. He's taken over Philip Alston's post, who was the special rapporteur for extreme poverty. But he commented on the UK saying what the government were doing was a deliberate undermining of rights, and charity was not a right. You know, he's on record. I mean, numerous reports, as you know, and if you want them, I can dig them out. But I mean, he was a real critic, saying this is, you know, you've got to think about the right to food, and at its most extreme, at least Healthy Start is a right. You know, we might have lots of problems with Healthy Start, but at least it's a right. It suited the government to monetize, or sorry, not to monetize, to charitize food, because what they've done is they're saving money. It used to be you'd go to your benefit office, you'd get money if you're in dire straits to buy food. It might have, at later stages of welfare reform, it was called a loan. It wasn't. You would technically had to pay it back, but at least you got money to go and buy food. Now what happens is you go to your welfare office and they send you to the food bank. So they're saving money, and people in welfare offices have key performance indicators to save money, and that's one of the ways they do it, by sending people to food banks. So the charity sector picks up the bill, you know, or the community does in lots of ways. So I'm rambling. So I mean, I think Scotland is probably the best example we have at the moment. The Northern Ireland report, no, so the Northern Ireland strategy is just out for consultation. There's quite a lot on food poverty in it. I'm sorry, the consultation actually shut last Friday, but quite a lot on food poverty, but not a lot on the right to food. So a number of us have fed into the strategy in Northern Ireland, which is part of the UK, saying, what about the right to food? You know, have you included this? What do you need to build this in? A reluctance to commit to it because people are afraid they will be held to account on it. I think that's the political fear.
Yeah, I find it interesting too, because here in the States, Maine just became a right to food state, but the way that it was enshrined in the amendment is that, you know, people have a right to grow food as they see fit, to slaughter as they see fit, to basically feed themselves, right? And so it's interesting that there's a lot of nuance in the definition of what a right to food could be or could possibly be.
Yeah.
And I'm just curious about government's kind of take on that, you know, if that's part of the hesitancy.
I think one of the things that, I mean, right wing or right-leaning governments will think about it in terms of opportunity, and left-wing governments, left-leaning governments will think it in terms of outcome, and that's a fundamental difference. So people will sign up to something like what you just described. People have the right to a healthy diet, but it's not our problem to provide that for them. I mean, so I think you'll find these tensions in the right to food. Actually, having said that, I think that's the way the London Food Board leans. I mean, it just suddenly struck me that it's about opportunity rather than outcome. And for me, it has to be about outcome. You know, it's not about, I mean, the whole, what they're called the leveling up agenda here, it's essentially addressing inequalities will not be addressed by just addressing, I mean, opportunity is important, but outcome for me is equally important. You know, it's all right saying people have choice, but actually some people don't have choice, or have less choice than others.
Yeah, and I couldn't agree more with that sentiment, because I feel like that's one of the things that's really missing from the current discourse, right? Is that there's an illusion of choice, but the reality is that due to food poverty, insecurity, inequality, all of these things, there is an inherent lack of choice for many people, or an inability to choose, as you said.
Yeah, I mean, I think there's lots of ways that the right to food could link with the marmot approach. You know, the structural inequalities issues. I mean,
Mhm.
I'm a fan of the concept. And I heard him talking a couple of weeks ago about food poverty, and he gets it. He's not specifically himself interested in food poverty. He's got bigger fish to fry in many ways, but he's not unaware, and he was clearly aware of the links between a lot of his work and food poverty. And I think it would be worth looking at that. And some of his team who are more interested in food than he is might be a good way or good allies to have in the Right to Food campaign.
Yeah, thank you very much for that. I was wondering if you could kind of speak more to your public health background and your knowledge about food insecurity and the outcomes that come from that. Specifically, I'm thinking of like the poor health outcomes.
Okay.
Here in the States we call it food apartheid or food deserts. But
what happened with public health in the UK 5 or 6 years ago was they shifted public health out of the NHS and back into local authorities. So public health is back in local authorities. For the first year or two, that money was ring fenced. So whatever money they had was kept for a year. Then that ring fencing stopped. And now public health has to compete for its budget within local authorities. And the big draw is social care, so elderly care and things like childcare, child abuse. I mean, they're competing with that with money. In real terms, they've lost huge amounts of budget in the last 5 years. I'd done an editorial in the BMJ, I think 2 years ago. And at that stage, I mean, I can't remember the figures, but it was huge losses to public health. So public health has been decimated at the local level, both in terms of funding, but also in terms of staff. For nutrition and food more generally, it would have been traditionally the public health nutritionists who took on that work. There's very few of them left in public health. Those that are left are now not practitioners, they're commissioners. So they don't go out and deliver services, they commission services. So we've got both a budget problem and a staffing problem, and I think an understanding of food problems. So we now have people dealing with food who may have no background in food, even if it was, and I would always argue nutrition was too narrow a base, but at least they knew something about food. Now we've got people commissioning services who have no understanding of food and food poverty. One of the things I constantly argue for public health at the local level, I mean, they're all concerned about obesity. Obesity is measurable, it's visible, it's costing huge amounts of money. And if you go back to the root causes of obesity, they're exactly the same as food poverty. I mean, at a structural level, there's practically no difference. I mean, there's a 95% differential between the lowest decile in terms of their obesity levels and their top deciles. I mean, and that's probably got worse during the COVID epidemic. And the point about that is we do have strategies for obesity. We don't have strategies for food poverty, but actually, or we have limited, but basically they're the same problem. Why aren't we treating them, having combined budgets to tackle poverty and food poverty? People don't seem to get that. They can't quite get the idea that the same communities that are hungry are also more likely to be overweight and obese. I mean, it seems to be, even public health people seem to have a problem grasping that. I remember having a conversation with Corinne at one stage, and she had problems grasping it until I pointed out in 1990, got it here on my desk somewhere, report from PAHO. I mean, making the link back that far. So, I mean, public health they haven't linked it up. They haven't done a sort of food and all policies approach. They're still working in silos, obesity here, little bit of food poverty here, smoking there. and I recognizing the problems they have with limited budgets and limited staff, I think they've got to move to more holistic approaches. And the right to food could incorporate the obesity issue, it seems to me. It could very easily cover both poverty, food poverty, and obesity. But they're on this, I mean, we haven't even talked about the impact of COVID on public health at the moment. You know, they're doing nothing probably but COVID work at the moment. I would even think a lot of the obesity work has been put on the back burner at the moment. But they're potential allies. They are potentially the public health, directors of public health across London are probably one of your strongest allies if you can get to them.
How do we kind of talk about food as a right in London, you know, and de-silo and food in all policies? How do we create that narrative so that people fully understand it? Because I think right now a lot of the discourse is focusing on, you know, that this is a leftist agenda, or that it's, you know, it's not for everyone, and that's highly problematic because it is for everyone. It's right there in the name.
I think you have to keep hammering the message that, you know, that this isn't just an individual and or a behavioral problem, that this is a structural problem. Mm-hmm. I mean, the links to me are clear with income and austerity. I mean, we've seen, you know, the research is pretty clear on this. I mean, people don't accept that research. I mean, politicians tend to argue, oh, well, it's just about cooking, or people aren't, you know, eating porridge anymore, and you can eat a bowl of porridge for 5p. Why aren't they doing this? I mean, Ian Byrne's campaign is interesting. I mean, it's gained some traction, probably more so than some of the other campaigns. To my mind, it's too charity-based, but nonetheless, it's got hearts and minds. Having that debate, I think, is necessary. I think one of the things that strikes me that's missing are I mean, it's like Witness to Hunger. The voices of people in poverty. And I'm not talking about, you know, the Trussell Trust putting forward 5 volunteers to talk about how the Trussell Trust was a great organization, or Fair Share putting forward, placing stories in the news. You know, that's not the voice, that's selection. But we need something akin to a Witness to Hunger, or people, the experts in food poverty, i.e. those who suffer food poverty, actually say, no, hold on, it's not about cooking. I can cook better than you, but I don't have enough money, or my food bill is balanced against my fuel bill, you know, whatever. We haven't actually got that voice. We've got representatives of that voice, but it's the old sociology argument. I mean, who was it? Friedson, I think, said the people who represent people. This is, I'm paraphrasing him, but he said the people who represent people with crutches end up using the crutches to play golf with the powers that be. So they're no longer representative of what they claim to be representative of. So, I mean, a Witness to Hunger, you know, that Mariana set up, I think is something. You don't have to set up a separate campaign, but we need to find a way of those voices coming into a right to food campaign. So when politicians say, well, it's just about cooking, or it's just about choice, or Michael Gove said Michael Gove's and represent it's just their own fault if they end up in food banks. There's a real voice saying, actually, hold on, that's not quite true.
Yeah, the parallels between the UK and the US as far as victimizing people who are experiencing food poverty and obesity are very obvious to me. So I really appreciate you kind of bringing that together. And I think, you know, the last question that Sharon wanted me to ask specifically is, do you feel that it would be better to lead the right to food with dignity as a principle? Or
I don't know. The danger with dignity is people can argue that, you know, if a food bank is run well, it can be dignified. I mean, our famous Jacob Rees-Mogg is on record as saying, well, his words are something, food banks are admirable, well, he misses the dignity issue. But there is an argument that people can turn. I mean, Fair Share will argue that it is with dignity. I mean, so there is the right to food is about people having the right to choice, I think, of which dignity is part. But I think if you hinge it all on dignity, people can argue, well, some food banks, and some, I'm a critic of food banks, but some are okay, others proselytize. But the bigger issue for me is that the setting up of food banks undermines our welfare state. That's my concern. But it also fragments society. So we now have Muslim food banks because they're afraid that their members will be lectured at or proselytized in Christian food banks. And also there's a lack of concern about appropriate diets as well. I mean, there is evidence of that, halal, where you should just be bloody grateful for getting anything we give you, the deserving, undeserving argument. So, I think you have to operationalize dignity and say what dignity is. Is it having cash is it the minimum income standard, by Donald Hirsch and people at Loughborough, where that's set at a ceiling level above which people should not rise, rather than a floor above which they should not fall. In my opinion, there's a difference there. Because everybody sets it at minimum standards rather than, but at least the minimum income standard has got some social and cultural elements built into it. So, can you eat out once a week? And they've developed regional standards, because what happens in Liverpool may be very different from what happens in London. But even in London, the boroughs are so varied. What a Somali in West London may have different dignity issues than a Muslim group in East London. There's cultural and social issues there. Dignity, yes. Yeah, I don't know. I think people understand dignity in different ways. I think there is a danger people could, I'm talking off the top of my head, I haven't really thought this through, that the food bank movement and others like Fair Share could reconceptualize that and say, well, all we need is better run food banks.
Yeah, there is a fear in that too, because I think, we've seen the evolution of food banks, rather than having just a standard bread line and canned and tinned goods, to having, markets that people can shop with dignity. But it's a food bank is a food bank, yeah.
Agreed, and it's the context. We have data from Northern Ireland where people from the nationalist community, i.e. Catholics, go to loyalists or Protestant areas because they're not known, and vice versa, because it's the dignity. If you go to your local food bank, you're likely to be known, and they're run on religious grounds. So people go to food banks where they're not known. There is a dignity issue. There's a lot of work on that, showing with the best will in the world, a lot of volunteers in food banks, and 95% are still run by volunteers, receive very little training in nutrition, in food. You receive a little bit of food handling of training because they have to, but they receive very little training on dignity or how to recognize differences. And this, well, you should be grateful for what we're giving you. Why are you asking for, halal products, or why are you asking for kosher products? And it's really, I think there's no problem if food banks are serving their own communities. Jan Poppendick picks this up in her book, saying, unions running food banks for their own members are very different concept of the church running food bank for a community of many of which are not its own members. but are forced to use it because they have no other choice. I mean, Jan makes that point in her book. I think that's true. If you're serving your own membership, that's okay. The problem becomes when you become the default for a community. Many people are not within your, inverted commas, your membership. That's a problem. But then, the old joke is there's more points for saving those lost souls than the ones that are part of your community. You get more points in heaven for that. So,
Martin, thank you so much for your time. I really appreciated learning from you, as always. Right now, we are focused on creating a campaign for the right to food in London. We believe that everyone should have the right to food and right to access to healthy and nutritious food. You can follow along at our Twitter at the Right to Food London, but you can also follow us along with our current campaigns at foodinequalitiesrebellion.wordpress.com.